Welcome to NEET Prep Go. So today we'll be doing the chapter 9 of Physical Education Class 12, that is Sports Medicine. Sports medicine is also known as sports and exercise medicine. It is a branch of medicine that deals with the physical fitness and the treatment and prevention of injuries related to sports and exercise. It provides us with deep knowledge about the creative and preventive aspects of sports injuries. So it is basically sports medicine, also known as sports and exercise medicine, a branch of medicine which deals with the physical fitness and treatment of injuries which athletes get while doing sports. It is also treatment as well as prevention of injuries. Now, concept, aims and scope of sports medicine. So in today's world, sports medicine plays a vital role in improving sports performance of players. With the help of sports medicine, a player can achieve top performance. There are various factors of sports medicine such as physical fitness, sports injury prevention and treatment, remedial exercises, nutrition, etc., which are used in improving the sports performance. Sports medicine focuses on helping people enhance their athletic performance, recover from their injuries, and prevent future injuries. Indeed, it is a fast-growing healthcare field. So, with the help of sports medicine, player can achieve its best performance. Okay, it can recover from its previous injuries and increases efficiency, overall efficiency, bounce back, and prevent further injuries too. Sports medicine is related to such human problems which usually arise during training and competition in sports games. The main objective of sports medicine is not only related to the world level performance but also adjustment of appropriate environment and health of sports person. Sports medicine is a branch of medicine in which various sub-disciplines are included, such as preventive sports medicine, physiology of exercise, therapeutic exercise, clinical medicine, and athletic medicine. So indeed, sports medicine is related to the medical science which deals with treatment and preventive care of athletes. A sports medicine team especially includes physician, surgeon, athletic trainer. Okay, so who are there in a sports medicine team? A sports medicine team includes physicians, surgeons, athletic trainers, physical therapist, coach, and other athletes, etc. Usually, sports medicine refers to training, preventing, and treating and diagnosing. So treating, preventing, and diagnosing sports injuries of players who get injured while playing sports. Okay, so the medical science, sports medicine deals with treatment and preventive care. The people who are there in the sports medicine team are athletic trainers, surgeons, physicians, physical therapists, coaches, and other athletes. And it basically focuses, sports medicine focuses on treatment, prevention, and diagnose of injuries of players, sports injuries which they get while playing sports. So according to Philip Adler, it is the practice of medicine in the area of health and fitness to diagnose, to treat, and prevent resulting from sports activities. According to Philip Adler. According to J.P.G. Williams, sports medicine is a specialized study of various physiological and pathological problems of athletes or sportsmen to maintain or regain extreme physical fitness. So Philip Adler said that practice of medicine in area of health and fitness which is used to diagnose, treat, and prevent injuries, which we already know what is sports medicine. That the same kind of was given by Philip Adler. Okay, Then J.P.G. Williams said that sports medicine is a specialized study of various physiological and pathological problems of athletes to maintain or regain their extreme fitness. Then Webster said that it is branch of medicine concerned with athletic conditioning and nutrition, treatment, prevention of athletic injuries, and improvement of athletic performance. Everyone is saying more or less the same thing. Sports medicine is a branch of medicine that deals with physical fitness and treatment and prevention of injuries related to sports and exercise. This is one of the main definitions which we have to learn. Now, according to Govard, sports medicine is the biology of men in motion. Okay, wow. And according to Lakawa, sports medicine is a branch of sports science which deals with athletes or sportsmen in preserving their health and increasing their physical performance to prevent the disease. Alright, to conclude, it can be said that sports medicine is a branch of medical science which deals with treatment of injuries related to sports and games. It helps in preventing, diagnosing, and treating sports injuries. It lays stress on improving sports performance of athletes. So, first, sports medicine helps in treating the sports injuries which we get while playing sports. It helps in preventing future injuries as well as it diagnoses the injuries, and overall it improves the athletic performance. These are the four most important points that should be there on your definition of sports medicine. Now, aim of sports medicine. Prevention, treatment. First one is to provide information to athletes about sports injuries. Each and every athlete to sports person about sports injuries. Okay, so each and every sports person should have complete information and knowledge about the injuries which usually occur during training or competition in their respective sports. Type of injuries usually different for all sports, so a sports person should have proper knowledge about the concerned injuries which he or she has in their own game. Okay, to provide knowledge about the cause of injuries. Well known fact that each and every injury has a specific cause. So another aim of sports medicine is to provide knowledge about the causes of injuries. There may be various causes of injuries such as improper conditioning or faulty technique or improper warming up or environmental factors or improper fitness, etc. To provide means or treatment of sports injuries and rehabilitation. Another significant aim of sports medicine is to provide treatment to the sports injuries and rehabilitate. After providing first aid to the injured person, the specialist for the sports medicine must be informed about providing treatment to the injured athlete. Rehabilitation, various medical treatments such as hydrotherapy, electrotherapy, infrared rays may be used. To provide knowledge about preventive measures of sports injuries. To provide knowledge about preventive measures, various sports injuries, another significant aim, athletes should be provided with enough knowledge in advance regarding the preventive measure of injuries. In this way, there will be rare chances of getting injured. So what are the aims of sports medicine? There are four aims of sports medicine. First is that it provides us to provide the sports person with information about his or her sports about the sports injuries. That is, each and every sports have their own sports injuries. So every sports person should at least have the basic knowledge of the kind of injuries that they can have in their sports. Okay, respective sports. To provide knowledge about the causes of injuries, the moment an injury happens, we need to know if there was a faulty technique or improper conditioning or improper fitness or improper training, whatever, warming up. Then third one is to provide treatment and rehabilitation. The treatment of the respective injury has to take place, and then rehabilitation. First aid is there to the injured. Then specialist of sports medicine, he provides treatment to the injured athlete, and then there are various treatments for rehabilitation such as hydrotherapy, electrotherapy and infrared rays. And lastly, to provide knowledge about the preventive measures too, so that in future the athlete knows how to prevent such injuries. Okay, so that rarely they may have to get injured. If you know the proper techniques and what to do in order to not get injured, then you won't get injured. There will be rare chances. What is the scope of sports medicine? In the field of physical education and sports, various subdisciplines of sports medicine are employed. On the basis of the study and research, different problems faced by sports person are solved or tackled. Without knowing in depth the scope of sports medicine, it is difficult as well as complex to take a sports person's performance to its highest point. That is why graduation and post-graduation levels, the various subdisciplines of sports medicine are included. These subdisciplines are included not only theoretically but practically also. Okay. So basically, in order to treat the sports person's injuries, you need to have sufficient education and knowledge. So without knowing in depth the scope of sports medicine, it is difficult as well as complex to take a sports person's performance to its highest point. That is why at graduation and post-graduation level, the various subdisciplines of sports medicine are included. Okay, they are there practically also, not just theoretical. First is human anatomy. and physiology, sports and first aid, prevention of accidents in sports and games, sports injury rehabilitation, female and sports, study of optimal load for different age groups, scientific promotion of sports and games, fitness for games and sports, illness caused by environmental, physiological and psychological disturbance, athletic nutrition, new methods of detecting doping, as well as use and abuse of drugs, preventive and curative exercises, sports traumatology, and physiotherapy. So these are the 14 different sub-disciplines, okay, from which you choose under sports medicine. Now let's we can remember 6, 7. First, see human anatomy, physiology, then traumatology, sports and traumatology. Some where, like, there are many Olympic players, they were silver medalists and then they are directly like out of the game, or they have been preparing for a competition for so long, and because of some kind of injury or because of some illness they are not able to participate, or they had a very bad downfall. So for them, since sports is their not only passion but job for life, everything, they get very traumatized. So sports and traumatology, physiotherapy, we all know physiotherapy, we require okay, like all different kinds of for different injuries, like if you're back pain, head pain, leg pain, knee pain. Okay, so physiotherapy, sports and traumatology, then first aid, sports and first aid, then human anatomy and physiology, that is also required, then prevention of accidents in sports and games, sport injury rehabilitation, fitness. You can remember these 3-4 words. Nutrition, okay, these are important ones you can remember. So preventive and curative exercises, so that is prevention, then traumatology, physiotherapy, rehabilitation, first aid, anatomy and physiology, prevention of accidents, so there are 2 prevents, female and sports, fitness and sports, and nutrition. At least you can remember these 6, 7 easily. Now let's come to sports injuries. Sports injuries are common in the field of games and sports. During practice, training, or competition, any player can be injured. Perhaps there is no player who has not been injured during his sports career. Indeed, it is natural to get injured. Though coaches, physical trainer, and sports doctor have been making their best possible efforts to prevent injuries, they have not been completely successful so far, though it is certain that with appropriate steps, the chances of acquiring injuries can be reduced during the game. Okay, in fact, sports injuries can be prevented to a certain extent if proper research is conducted in this domain. During training and competition, proper protective equipment must be used. Such players who do not use protective equipment should not be allowed to participate in sports competitions. Proper conditioning should be done before taking part in sports competition. Playing as per rules and proper officiating can help in preventing sports injuries. Warm-up should also be performed before training and competition. Scientific knowledge of sports can also be beneficial, preventing sports injuries to an extent. Leonardo da Vinci also averred, if you are enamored of practice without scientific knowledge, you are just like a pilot who goes into a ship without rudder and a compass and does not know his destination. It has been observed minutely that single type of injury does not occur in all games and sports. Indeed, some sport injuries can be prevented if some changes are made in the rules of games and sports. Okay, so sports injuries is very common. Firstly, there is no sports person till now who hasn't had a sports injury in his or her sports career. All the coaches and okay, so even though the coaches and doctors and physical trainers, they try to prevent maximum sports injuries, still still they have not been completely successful. Okay, so sports injuries can be prevented to a certain extent if proper research is conducted in this domain, and if protective so basically the protective equipment should be used, and otherwise the participants should not be allowed in the sports competition. Proper conditioning should be done before taking part, and Leonardo da Vinci said that if you are if even if you have enamored practice without scientific knowledge, if you go to the if you're a sailor and you go to the sea without having compass or map or anything, then you are then and you don't know the destination, then there's no point. So similarly, if you are a very good athlete, you have skill, you have that kind of endurance, but still you don't know what are the preventive measures, you have no knowledge about sports injuries, you do not use protective equipment, you are neglecting your own physical health as well as your game, so then there's absolutely no use in that. Now let's come to the classification of sports injuries. Okay, so there are three kinds of sports injuries: soft tissue injury, bone injuries, and joint injuries. Under soft tissue injuries, there are three subtypes of injuries. First is contusion, 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 then strain, then sprain, then abrasion, and lastly bruises. So what is contusion? Contusion is a muscle injury, a direct hit with or without any sports equipment, which can be the main cause of contusion. So when someone directly hits you, then with or without any sports equipment, that can be the main cause of contusion. It can also be due to minor accidents to the skin, such as falling, bumping, or being hit or kicked. Contusion is a common in boxing, wrestling, kabaddi. In contusion, the blood vessels in the muscles, they get broken. Okay, bleeding may occur in the muscles, which may cause a bruise. So here's a picture you can see. Okay, it won't be that clear, but basically your the blood vessels in your muscles, the moment you get a direct hit on it, then over here internal bleeding starts, which may become a bruise later on. So the raised area of contusion is due to accumulation of blood and fluid from the injured blood vessels of the tissue. So the blood vessels, they break inside the tissue. Stiffness and swelling are common feature at the site of contusion. Sometimes in severe cases, the muscles also fail to respond. Sometimes muscles fail to respond. In severe cases, muscles become completely inactive. Prevention. Proper warm-up is essential before practice, training, and competition. All parts of the body should be exercised properly. Stretching exercises should be performed. Conditioning should be emphasized during preparatory period. Protective equipment should be used according to the requirement of the game. Sports equipment of good quality should be used in the game. Play fields, courts should be smooth and clean. For preventing sports injuries, complete scientific knowledge about game is a must. Players should be careful and alert during practice and competition. Good officiating quality of official is must for preventing sports injuries. So how can you prevent contusion? You can prevent by warm-up, stretching, and before the competition or training or practice. Then conditioning during the preparatory period. Protective equipment should be used at all times. The sports person should have knowledge. Player should have knowledge about complete scientific knowledge about the game for preventing sports injuries. Play fields or courts should be smooth and clean. Sports equipment of good quality should be used in games and sports. Okay, and good officiating quality of official is must for preventing sports injuries. Now, strain. Strain is also a muscle injury. Strain can be mild as well as severe. Sometimes the complete muscle can be ruptured. In case of complete rupture, it is not possible to move that part of limb. There may be severe pain around the rupture. Strain may occur at any time during the practice or competition. As a matter of fact, strain is caused by twisting or pulling a muscle or a tendon. It can happen suddenly or develop over days or weeks. A sudden acute strain is caused by a recent injury like lifting heavy objects or rods in the wrong way and overstressing the muscles. Chronic strains can usually be caused by moving the muscles and tendons in repetition. Prevention. From the prevention point of view, every sportsman should undergo a complete warm-up before participating in any sports activity. He should do stretching exercises for all parts of the body. Conditioning again should be done. During preparatory period, sports equipment must be of good quality. Play field should be smooth. Scientific knowledge of the game must be there. Players should be careful and alert, and good officiating quality is necessary to prevent injuries, and players should discontinue to play during the state of fatigue. Okay, so that is the only extra point. The rest all points are same. So what is strain? Strain is a pulling or twisting of a muscle or a tendon is called as a strain. Sometimes it is not that severe. Sometimes it is mild. Sometimes it is severe. The complete rupture of the muscle can also occur in severe cases, and it is really painful. It may occur during practice or in the competition. Prevention, how to prevent? Every sports person should undergo complete warm-up. There should be proper conditioning. Sports equipment should be of good quality. Play field should be smooth and clean. Scientific knowledge must be there to prevent strain. Players should be careful and alert. Good officiating prevents sports injuries, and players should discontinue in the state of fatigue. Sprain is a ligament injury. It may occur due to overstretching or tearing of ligament. Many things can cause a sprain. Falling, twisting, getting hit can force a point out of its normal position. This can cause ligaments around the joint to tear. Generally, sprain occurs at wrist joint and ankle joint. Sometimes fracture is also possible along with sprain. In such injuries, swelling, inflammation, severe pain and tenderness are common symptoms. There can be laxity in the ligament. All the above mentioned symptoms depend on the severity of the sprain. So sprain is basically a ligament injury which occurs due to overstretching or tearing of a ligament. So when a ligament gets overstretched or torn, then sprain occurs. A thorough warm-up is necessary for preventing sprain. Especially all joints should be exercised well. Proper conditioning. All sports equipment should be of good quality. Playfield should be smooth. Good officiating can prevent injuries. Rules of the game must be followed. Players should be careful and alert during the training and competition. Players should discontinue in case of fatigue. Always try to eat the extra points now. Okay, always try to eat a well-balanced diet to keep muscles strong, maintain healthy weight, try to avoid falling, wear shoes that fit well, wear protective equipment when playing, and try to run on flat surface. Now we come to abrasion. Abrasion is a major injury. Abrasion usually occurs due to friction with certain equipment or fall over the area where bone is very close to skin. It may be caused by falling on a hard surface. When someone falls on slides or grounds, layers of skin rub off due to friction. It can occur on basketball court where the surface is slightly rough. Along with this, it can occur in kabaddi, athletics, hockey, football, etc. It is less severe than laceration and bleeding. If present is minimal. Mild abrasions are known as grazes or scrapes. They do not bleed, but deep abrasions may lead to bleeding. So basically, abrasion is a major injury. It usually occurs due to friction. Okay, when with certain equipment or the fall over of the area also. Where the bone is very close to the skin. So basically you skid off and multiple layers of skin just come out. Okay, like multiple layers of skin get rubbed off during friction. It can occur on the basketball court where surface is slightly rough. It can occur in kabaddi, athletics, hockey, football. Usually in football it occurs, that I know. So mild abrasion are grazes or scrapes. They do not bleed, but the more severe or deep abrasions may lead to bleeding. Then prevention. Players should undergo proper warm-up before training. They should have proper conditioning. Sports equipment should be of good quality. Good officiating can prevent is essential during practice and competition. It can prevent sports injuries. Players should be careful and alert during the practice and competition. Players should follow the rules. They should wear protective equipment while playing the game. One should try to cover the exposed area with a layer of clothing. Okay, so this is the extra point. then don't push your body beyond your current fitness level, and then learn the corrective technique before taking part in sports. Now, bruises. Sometimes injuries like bruises may occur in football, hockey, and boxing. Football, hockey, and boxing. Bruises are not clearly seen because the upper skin remains unaffected but inner tissues are damaged. In fact, the blood spreads under the skin because of ruptured blood vessel. As a matter of fact, blood from damaged blood vessels beneath the skin collects near the surface of the skin, resulting in a black and blue mark. It must have happened to many people, okay? When you get bruised, usually bruises occur to sports person when they bump into some sports equipment. In fact, bruises can occur to athletes and weightlifters who work out rigorously. Initially, a fresh bruise may actually be reddish, and then after a few hours it turns blue or dark purple. Okay, so we all know how getting bruised is. Okay, in boxing or in football and hockey, your upper skin remains intact, but the lower skin, the blood vessel gets ruptured and blood spreads under the skin and it collects near the surface of the skin. What is the difference between bruise and contusion? In contusion, the blood vessels broke in the muscles. Basically, blood vessels in the muscles are broken and therefore they can lead to bleeding, bleeding in the muscles, which may cause a bruise. And the raised area of contusion is due to accumulation of blood and fluid in the tissue. Okay, but over here in bruises in any part of the body, okay, when the blood vessel inside gets damaged, not muscle specifically, not inside muscle, just inside, and the blood collects beneath the skin, we call it a bruise. First it's red in color, then it becomes turns blue or dark purple. Players should undergo adequate warm up. Okay, they should have a good anticipation power. Players should be careful and alert during practice and competition. They should not be rash. Okay, they should play according to rules and regulation. Play field courts should be smooth and clean. They should not continue in case of fatigue, and they should use protective equipment. Now we come to bone injuries. There are the following types of bone injuries: simple fracture, compound fracture, complicated fracture, green stick fracture, comminuted fracture, impacted fracture. Okay, just